Well, welcome, everybody, to the committee meeting for Health and Human Services. Therese, do we have attendance?
We do. We have a full committee, except Supervisor Lant is excused.
Got it. Do we have a motion to accept the minutes of September 29th?
So moved, Supervisor Wood.
Second, Supervisor Connolly.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried. The next item on the agenda is the mental health services provider contracts. Dr. Prezioso.
Thank you, Mr. Chairman. I've got essentially a housekeeping resolution to speak with you about. This is the annual renewal of our contract with our service providers. I would like to call your attention to the fact that we did have one correction to make on the second page for Mechanicalville Area Community Services Center. The total amount remains the same, but the correction involves the addition of the county portion of those funds. So in the original that you received, you'll see New York State OMH 13,506. That was broken out. New York State OMH 10,084. Saratoga County 3,422. The OASAS amount that you see there, 1,486, that remains the same. And again, this is essentially a housekeeping item. It's a renewal of annual contracts. The only other change I'd like to point out is after consultation with County Attorney Hartnett, we are moving from annual renewals to renewals once every 3 years on these contracts.
Makes sense to me. Do we have a motion for this resolution?
Supervisor Winnie will make the motion.
Got that, Therese? Discussion? Any questions for Dr. Prezioso? Comments? All in favor?
Aye.
Aye.
Opposed? Carried. Next item on the agenda is OMH state aid for cost of living. Dr. Prezioso, is this $213? Is that what this is
That's the one.
referred to? Okay.
Yeah, this is a cost of living increase. It's effective beginning of April this year through December of this year. The amount is $213. And per past resolution, when we receive an amount of this type that's less than 10% of contracted amounts, then it's customary, it's by resolution that this committee can accept those funds without having to take an entire resolution back to the full board.
Sounds good to me. I don't think this is real controversial. Do we have a motion to pass that resolution?
Supervisor Wood, I'll make it.
Second, Supervisor Connolly.
Discussion? All in favor?
Aye.
Opposed? Carried.
Thank you, Chair.
Thanks very much, Dr. Prezioso.
Thank you.
All right, we have contract tracer agreement. Dr. Kuhls.
Good afternoon. This request is seems to be now standard for each of our contact tracers as we continue our program. This is for Shelby Farrell, who is one of our best contact tracers and who is approaching the maximum amount under her current contract, and we're requesting that it be modified to or reauthorized for a major contract so that she can continue her work with us.
Sounds good. Do we have a motion to approve that?
So moved.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you.
Thanks, Dr. Kuhls. Next, Sandy, we have our aging subcontracts for 2022.
Yes, I'm requesting a housekeeping resolution also for our new going into 22's contracts. There was a list that was passed out to everyone requesting that the chairman be authorized to sign contracts with the following vendors. And I will point out that there were a few increases. For our dietitian, we increased her $7 an hour. She has not seen an increase in 5 years. And for Greater Adirondack and Wesley, the rate per hour went from $24 to $25 an hour. Everything else is the same except for, Connect America. We had, for our PERS, the button that the seniors wear, we had, it was Best Buy and they got bought out by Comcast and we've had a horrible time with them. So we did find a new a company that actually St. Peter's goes with in the region. It's called ComQuest America. So they'll be in place of the previous personal emergency response provider we had.
Got it. Thank you, Sandy. Do we have a motion for this resolution?
Supervisor Winter make the motion.
Do we have a second?
I'll second.
Discussion or questions for Sandy? All in
I have
favor?
one-
Go ahead. Go ahead.
I have one question. Sandy has sent out for volunteers for delivering food. This has probably nothing to do with it, but how is she coming with that? Is she getting any?
We are getting a great response. So yes, I would love to thank Christine Rush for all her help. But yes, our phone is ringing off the hook. So yeah, we're getting lots of volunteers. So yep, we're very
Thank you.
happy.
That's
Thank
great
you.
news. Good question. Thank you. Okay, I think we have a motion and a second. All in favor?
Aye.
Aye. Opposed? Carried. Other business, all the supervisors have been in constant communication with Dr. Kuhls about the status of the whole COVID thing, but, this is always an appropriate time if any supervisors has questions for Dr. Kuhls on how we're doing with COVID in terms of the testing, the schools, the clinics. We're generally kept up to date on that as a regular matter, but since this is a health committee, I just wanted to open that up for any questions or comments from Dr. Kuhls or to Dr. Kuhls. How are we doing on the testing in the schools? I know they were having all kinds of problems, Doctor.
Thank you. They're coming along. Anytime you initiate a new program, there's sometimes bumps in the road, but the schools are doing a very good job. Many of them, some of them are already, all of them are testing the staff that are unvaccinated, which is the state mandate. And many of them are offering screening testing to students whose parents choose to opt in on that. More will be coming along in the next couple weeks. And our department has also been offering testing for students to help out both the schools and the pediatric providers in the county.
Sounds good. The clinics that we're providing, I noticed that we're still providing the vaccine in accordance with the first one that the people took in terms of the booster shot. Will that change for any of our clinics, or is that the way we're doing it for the foreseeable future?
We're working on a press release now. We'll be offering Moderna to anyone that's eligible, so that there's now a mix and match. Residents should talk to their healthcare provider about which booster is best for them. But we'll be offering that Wednesday to individuals that are 65 and older and qualify. And then in the afternoon, that'll be for the balance of the day. And late in the afternoon into the early evening, we'll be offering it a special clinic for school teachers and staff that want a Moderna booster. We're doing everything we can to keep the schools as safe as possible.
All right. Thank you. Thanks very much. Any other questions for Dr. Kuhls?
Dr. Kuhls, this is Supervisor wondering. I'm just curious, is there a mandate for these pupils to get this vaccine from 5 to 12? Is it mandated or not for students to get it?
There's no mandate for a 5 to 11-year-old to once it's still in the process of receiving or attempting to receive an emergency use authorization. But at this time, pending that, there is no mandate in New York State for kids to receive a COVID vaccine for school entry.
Okay. How long do you think our children are going to have to be masked in school?
It's hard to predict, what will happen with COVID. I'm hopeful that once we get through the 5 to 11-year-old population and then late year December, late December, early January. I'm hopeful that either both Pfizer or Moderna vaccine will be approved for individuals 6 months and up. And I think once you start getting good coverage in that population, the exit strategy for many COVID-related things becomes a key question. But as you know, the mask issue in schools is a mandate from the governor.
Thank you, Doctor.
Thanks, Doctor. Any other questions for Dr. Kuhls? Any other business? Okay, do we have a motion to adjourn?
So moved.
I'll
And do we
second.
have a second? Discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Thanks very much, everybody.
Thank you, Darren.
Thank you.